Marie. Welcome back to Body Beautiful. With us today, we have plastic surgeon Dr. Joseph Mealy. We have been discussing breast enhancement surgeries, all about them, and I am going to go right to the phones because we have a phone call from Sonia in Pacifica. Sonia, are you there?
Yes.
Hi, Sonia. How you doing today?
I'm good, thank you.
All right, Dr. Joseph Mealy is here. Please ask him your question.
Oh, okay. Hi, doctor. My question is, I plan on getting I'm thinking of getting a lift, and I had thought about getting implants, but what is the lifespan on those? Because I hear that at some point you got to take them out.
You know, it's good to have that thought in your head before getting implants because sometimes they do require maintenance. They're not a lifetime guaranteed medical device. The FDA tells us we can't tell people they're lifetime devices. The reason for that is sometimes they leak. Now, the newer implants leak less than the ones in the past. We were talking about gummy bear implants earlier. The 5-year data has just come out on those. Their leakage rate is about half of what we were having before with the previous gel implants, and the same with this, and half of what we get with the saline implants, because those were pretty safe, or pretty much the same. The lifespan is variable, though. There are some people who will have leaking early. Usually, like anything else, as it gets older, it's more likely to leak. So leaking may occur 20 years later. The implants do come with warranties, believe it or not. So the implant itself is always replaced. If it leaks within the first 10 years, you get money towards the surgery to replace it. Or if it's something that was done for cancer, then it's always covered by your insurance.
Sonia, does that make you feel better?
It does.
And why are you getting a lift, may I ask? Because
well, I just recently turned 40, and I have 2 children of my own, and I just feel like, you know what, I just want to enhance my body now and just feel a lot better about myself, and I thought it would be a great thing to do at some point. So.
Were you thinking of mommy makeover also? Are you going to combine it with anything?
I definitely am, yes. I want to add a tummy tuck to it as well.
Well, you're asking good questions, so it sounds like you're thinking about the right stuff.
I am.
Exactly. Okay, so did we answer your question?
You did. Thank you so much. Thank you, doctor.
You're welcome.
All right. Thank you, Sonia. Good luck with that. All right, let me talk to you about who is qualified to perform these surgeries. How can we find the best person?
Sure. Most commonly, it's a plastic surgeon. You want to find a board-certified plastic surgeon.
Okay.
What that means is they've had the proper training, they have the prerequisite training, and if they're board-certified, it means they've also been analyzed by their peers through testing, so both written and oral examinations. And that's become even more important. Used to be you were board-certified after you graduated and took your exams. Now, there's something to do every year to maintain your certification, and every 10 years there's another exam, and that's ongoing. We're trying to find the best way to make sure people are still up to date and safe and are doing the best surgeries possible for their patients.
And you're definitely qualified. You've done a lot of these, correct?
Yes, and that helps too. Find someone who does
Find someone who does a lot of them.
Yeah.
And what is the most, who comes in a lot for a certain procedure?
It all depends on the procedure, and that's part of what I love about plastic surgery is we see people who have birth defects who are very young. We see folks who are old who have skin cancer, everything in between, and that variety really keeps me going.
And we've heard from a lot of women today. I want to know about men. Are men coming in for procedures as well?
Surely. Yeah, I mean, if you look at the cosmetic stuff, traditionally it's always been female-dominated. Men probably account for 15–20% of the practice, of my practice.
Because I think a lot of men are afraid to actually, investigate and go out there and see. But
well, plus we don't have children, and that's the main reason I see a lot of folks.
But with the we've got to keep in shape now. We're younger people in the workforce. We've got to play the game as well. So do you see a lot of men coming in for a little freshen?
I see them for facelifts, eyelids, breast reduction, for gynecomastia reduction, rhinoplasty are probably the most common procedures for men.
Wow, that's amazing.
And liposuction, that's probably the most common for most people.
Yeah, that's true. That's for both, right?
For both men and women.
Yeah.
Though implants have been in the lead the last few years.
Have they really?
Yeah.
Okay, good. Well, we know we have those new gummy bears out there. Saline, everything. All right. Thank you for all that great information.
Oh, you're very welcome.
If you need more information, just call Dr. Mealy. His number is 925-943-6353, or check him out on the web at either drmealy.com or sanfranciscobreast.com. Thank you for your time, doctor.
Thank you.
Thanks for all your calls. We'll see you next time on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.